Get it, Darcy, come on. Come on, oh, that's good.
Dogs love to chew things and puppies can't get enough of it. Usually it's just harmless fun, but you'd be surprised how many dogs end up in the emergency room with something that can't be digested stuck in their intestines. Undies, socks, rocks, they all have to be surgically removed.
That's it, get it, that's it.
What are the most common foreign bodies that you're retrieving from dogs?
They would include material, clothing, socks, underpants probably, some string and rubber items and small toys or kitchen products, caps from detergent bottles, parts of a tennis ball, that's pretty common. Some vegetative matter, such as pips from fruit. I mean, there's a lot of fruit lying around and some dogs like fruit. Bones would be a very common one, and there's a lot of discussion out there as to whether they should be cooked or raw, or whether they should be a huge big cow's thigh that they're polishing their teeth chewing and then take it away, or whether they should actually be allowed to lie on the lawn all afternoon and crack it into bits and swallow them. So as a surgeon, I'd just like to point out that opening a dog's stomach up to retrieve something like this is quick and easy. You're coming in through the abdomen and making an incision in the stomach. But the ones I get called in for as a specialist are the bones that get stuck in the esophagus before it makes it into the stomach. That's much more involved.
Like your ossobuco bone, the partial obstruction.
That's right, and we're doing a thoracotomy, and so the post-operative care is a much bigger deal.
And you can get scarring of the esophagus, can't you?
You can. So the stomach and the intestine's quite forgiving to operate on, and you can remove sections of the intestine if they're damaged, whereas the esophagus, we can't remove it. The healing is compromised, the access is compromised, and if it strictures and forms a narrow section, that dog may have a permanent problem with swallowing.
So quite dangerous.
Yep.
And Chris, what's going on here? This one just walked in the door literally now, didn't it?
Yeah, so this Doberman's just been referred in for a known ingestion of a rubber ball that we are currently deciding on what options we've got that we can present to the owner and what option might be the most direct. So simplistically, the approach to this would be to make the dog vomit. And if that doesn't work, then under anaesthesia we pass a fibre optic telescope so that we can visualise the foreign body and try and pass a grasping device down to retrieve it. If that is unsuccessful, then we would go to surgery. So we'd come in through the abdominal wall and make an incision in the stomach to remove it.
So it's going to be a series of tests and attempts and probably end up being an expensive surgery.
Yes.
Not all insurance companies cover intestinal foreign body surgery in their basic package. Fortunately, HIF does, but they only cover it once in a 12-month period. So if your dog is prone to eating things that they shouldn't, then it's best to keep all those things up safely out of the way. Isn't it, Darcy? Yep, and we can keep playing with this, can't we? Okay.